from Juba, on air and online.
This is iRadio News.
Hello, good morning. This is iRadio News. First, here are the headlines. A legal expert says gaps in South Sudan's medical laws are exposing doctors to physical attacks and improper lawsuits. The World Food Programme has called on the government of South Sudan to increase domestic investment in education, warning that international funding alone is no longer sufficient to sustain school feeding programs. And a group known as the Permanent Members Association has donated supplies to Munuki Primary Health Care Center in Juba of Central Equatorial State as part of its annual community outreach initiative. This is stories and more coming to you in this news bulletin with me, Lasuba Memo, and now the news in detail. A legal expert says gaps in South Sudan's medical laws are exposing doctors to physical attacks and improper lawsuits. Dr. Barnaba Corina Lobeng, Executive Director of the Vision Center for Legal Studies and Training, says only 3 laws regulate medical practice in the country, including the Medical Council Act of 2014, the National Public Health Institute Act of 2023, and the Drugs and Poison Controls Act. He says these laws are too limited to effectively address medical liability. Speaking during a public legal discussion on Friday, Dr. Corina explained that the Medical Council Act mainly focuses on registration, licensing and professional supervision, but does not clearly define criminal responsibility for medical errors. He said that the law was issued by presidential order and was largely copied from Sudanese law, but key sections on crimes and penalties were omitted. According to Dr. Corina, criminal law requires that offenses and punishments be clearly stated in legislation. As a result, doctors should not automatically face criminal charges for medical mistakes, which are often civil or professional matters. He warned against the growing practice of physically attacking doctors or reporting them directly to police after poor medical outcomes. Dr. Corina said complaints should first is submitted to the Medical Council, which has the mandate to investigate through expert committees. He added that serious crimes such as organ trafficking or illegal medical procedures can still be handled directly by criminal justice authorities. The World Food Programme has called on the government of South Sudan to increase domestic investment in education, warning that international funding alone is not longer sufficient to sustain school feeding programs. The call was made by WFP Country Director Mary Helen Magorty following the signing of a 3-year agreement worth more than $1.6 million between WFP and the Ministry of General Education and Instruction. The Memorandum of Understanding was signed by the Ministry's Undersecretary Kachwal Mabil Piok and the World Food Programme Country Director on Friday. Speaking after the signing, Magorty said the funding allocated through the Global Programme for Education will support homegrown school feeding initiatives and strengthen national ownership of school meals. She said, however, that for school feeding programs to become reliable and permanent, South Sudan must increase domestic investment, especially at a time when international resources are increasingly stretched. Magorty said WFP currently supports school meals for more than 350,000 children and aims to expand the program to over 700 schools. She added that government's investment is key to sustaining and expanding the initiative in the longer term. The agreement is expected to support education and school feeding efforts over the next 3 years as partners work to improve access to learning and build human capital across South Sudan. A group known as the Permanent Members Association has donated supplies to Munuki Primary Health Care Center in Juba of Central Equatorial State as part of its annual community outreach initiative. The donation was delivered over the weekend and accompanied by the Central Equatorial State Minister of Gender and Social Welfare, Zendia Eluzai Abu. The items were officially received by representatives of Munuki Healthcare Center. The donated supplies included sitting benches, bed sheets for the maternity ward, chairs, and other essential items aimed at improving service delivery at the facility. Speaking during the handover, Francis Laudu Louis, a member of the Permanent Members Association, said the contribution reflects the members' commitment to collective well-being, particularly supporting people who are sick or facing difficulties. The in-charge of Munuki Primary Health Care Center, Veronica Ageno, welcomed the donation, saying it will help address challenges such as inadequate seating, which affects both patients and health workers. Meanwhile, Zendia Luzai Abu pledged her continued support to health facilities across the state, saying her ministry is ready to assist whenever there is need. According to Francis Lodu, the donation is part of the association's annual outreach program aimed at promoting development and improving service delivery in Central Equatorial State. This is iRadio Morning News, and at the international scene, Nigerian authorities say they have secured the release of the remaining 130 school children kidnapped from a Catholic boarding school in the country's central Niger State. Nigeria's federal government described the latest release as a moment of triumph and relief after one of the country's worst mass kidnappings. More than 250 children and staff were abducted from St. Mary's Catholic School in Paperi on 21st of November. Earlier this month, about 100 of the children were released. The authorities confirmed the rescue of the remaining 130 children and staff in a statement, saying not a single pupil is left in captivity. And finally, the U.S. Coast Guard is in active pursuit of another vessel in international waters near Venezuela as tensions in the region continue to escalate. U.S. authorities have already seized 2 oil tankers this month, one of them on Saturday. Sunday's pursuit related to a sanctioned dark fleet vessel that is part of Venezuela's illegal sanctions evasions. U.S. officials said it is flying a false flag and under a judicial seizure order. Washington has accused Venezuela of using oil money to fund drug-related crime, while Venezuela has described the tanker seizures as theft and kidnapping. This is our Radio Morning News, and to end this bulletin, here is the recap of the headlines. A legal expert says gaps in South Sudan's medical laws are exposing doctors to physical attacks and improper lawsuits. The World Food Programme has called on the government of South Sudan to increase domestic investment in education, warning that international funding alone is not longer sufficient to sustain school feeding programs. And a group known as the Permanent Members Association has donated supplies to Munuki Primary Health Care Unit in Juba, Central Equatorial State, as part of its annual community outreach initiative. That's 10 to 5 Radio Morning News. If there's a story or an event you'd like iRadio to cover or report about, please send us a text message at +2 1925 287 870. It's also a WhatsApp number. Follow us on X at iRadio Juba. Like our Facebook page, iRadio. Subscribe to our YouTube channel at iRadio South Sudan. You can also visit our website and listen to us online at www.iradio.org. Stay tuned for the news in Arabic at 8 o'clock. I'm Lasuba Memo. Thank you for listening.